Crook, thanks for joining us on the TEMSEA podcast
Yeah,
today.
for sure.
Yeah, for those that don't know you, tell us a little bit about your journey in EMS.
So I grew up in Middle Tennessee, and coming out of high school, actually started in a junior firefighter program, was able to get my EMR, and then went to EMT school subsequently after that, but did sort of fire suppression rescue and some EMS as well, and really discovered my love for medicine through that, pursuant to that, went on to do med school and things like that, but have circled back around to be involved in the EMS realm. Just, couldn't shake it.
Yeah, well, it's an honor to have you be part of this. So you work at an academic medical center. Your experience is incredible. I know you focus on ED. You were a flight physician for a long time, and now you're heavily involved in medical directorships. And one of the unique things I know you personally and have seen the work that you've done is you're a very hands-on medical director. You are on the engine, you are in a car, and you're responding to cases.
Yeah.
And what have you learned over the last couple of years since doing that about the EMS community and your appreciation? And so just kind of walk us through that.
And so in my job, as you mentioned, I split time between, of course, the emergency department and then also doing EMS sort of duties, which I'm fortunate, even from the emergency medicine or ED side of things, I split my time between downtown Nashville and then also out in the community, sort of in the areas where, the crews that I'm working with, bringing patients there locally as well. So I think it's one of those things that sort of the farther that you get into your career, you sort of figure out that the less that you know about many things. So, it was an interesting transition, and I still maintain a paramedic license now, but interesting to transition from a role of being a practitioner, from that standpoint to now on this side. I think I figured out that it takes a lot more listening than doing. A lot of times on scenes, really, there's not much that is needed for me to add medically. Sometimes maybe, it's you provide a little bit of that sort of support that, just kind of, hey, I'm here, if you need me. But really, as far as a lot of the hands-on sort of stuff, the crews are very adept and well-versed at doing their job. And sometimes it's as simple as just, I carry the bag out at the end, So I've learned that there's a lot more kind of watching, listening. And really that helps to inform my role as a medical director to see what's going on, what's working, what's not, what do we need to change? It's immensely valuable from that standpoint.
Well, from a medic, obviously you're working in the hospital setting now, but, experiencing that very, very few times, to be able to have that support is incredible. And it's rare. And for you to be able to serve the EMS community in that way is incredible. I also want to acknowledge that, you are a recognized leader in the state. You are on the subcommittee of the state EMS board, the Leadership and Advancement Committee. We're serving on that together. And for you to be involved at your level, we really appreciate everything you've done for the community and for your service. And we're grateful you hung out with us today.
Yeah, for sure. And it's, my pleasure to be able to do this. I love the emergency department, but getting out and actually being able to do things outside of the constraints of the ER and, quite frankly, see a lot of my friends that I've developed relationships with over a period of years, and to be able to work alongside them is just really cool and very rewarding. It keeps things, fresh for me.
Well, we appreciate it.
Thanks, Eric.
If you like this episode, check out the full podcast right here. If you want to see more videos, you need to check out right here. Remember, the most important person you're ever going to lead is you.